Well, I so appreciate being here, and I'm thrilled to talk about school nursing, my absolutely favorite topic. I want to tell you a story to start. A 4-year-old preschool girl is stuffing her school lunch into her pants pockets instead of eating at school. This same little girl refuses to eat her breakfast or afternoon snack because she says that she's saving her food for home. Her family escaped a dangerous Central American country and traveled for more than a year on foot to seek asylum here. The school administrator called and asked, "How can we help this family?" And I thought to myself, how can we help a traumatized family assimilate into a foreign country with nothing but what they carried on their backs? It's a big question, and it's one that repeats itself in my school community and many others across the country. I am a school nurse, a relentless one, because that is what it takes to care for students and families with complex health and social needs. September will begin my 19th year serving the families of Camden, New Jersey, right across the bridge. This urban school district is only 13 miles from where I live, but it is a world away, where 37% of families live under the poverty line, and there's a 10-year gap in life expectancy. The 2 zip codes between where I live and where I work tell a story of the impact of privilege versus poverty. School nurses, though, are population health gold because we are at the epicenter of the concerns that children bring to school every day. From increasing gun violence in schools and communities, threats to undocumented families, the opioid crisis, homelessness, hunger, racism, transportation barriers, chronic absenteeism, mental health crises, adverse childhood experiences, toxic stress, and I have not yet even mentioned one health condition. We function in a hidden healthcare system that has been widely misunderstood. Being relentless is our only choice. Dr. Erin Mon, the Director of Research for NASN, published an article entitled "School Nurses, an Investment in Student Achievement," and she wrote, with nearly 20% of students entering school with chronic health conditions such as asthma, life-threatening allergies, diabetes, and seizure disorder, school nurses provide not only direct care to those students with needs, but we empower students to manage their own chronic conditions and work with students, their healthcare providers, school staff, and the community to coordinate the students' needs. At the same time, school nurses can detect illness early, prevent its spread, and identify students at risk, while also advocating for the well-being of the entire community. Population health gold. The return on investment is at least 2 to 1, and truthfully, it could be much higher, but we need research in order to fund these studies. Sorry. One of my personal and professional goals has been to amplify the voice of school nursing and elevate the profile of our profession. I do this through a weekly blog called What Else But the Relentless School Nurse. I spotlight the work of my colleagues, school nurses across the country, and leverage the power of social media, especially Twitter. I hope you all get on Twitter, sharing these important stories that illustrate the impact of school nursing on children, families, and communities. But we cannot work in isolation, although school nursing can feel isolating at times. The overwhelming needs of the students and families I serve, coupled with my niece surviving the 2018 school shooting in Parkland, Florida, turned me into a school nurse activist. My outrage fuels my actions, and I now sit on the advisory board of Affirm Research, a national apolitical gun violence prevention research organization where I am, but should not be, the only nurse. There's a saying in public health that you can't boil the ocean, but you know what? You can boil your part of the ocean. So to continue this metaphor, here was one of the flames that got my temperature of my part of the ocean rising. In 2015, I became a Johnson & Johnson School Health Leadership Fellow. a member of an interdisciplinary team that included 3 school nurses and 2 community partners. And we looked at the overuse of the emergency department by Camden Families for Non-Emergent Care. We introduced community cafes, an evidence-based program, and we asked what was working and what wasn't working in your child's healthcare experience. One simple question. But we asked the experts, the parents, the caregivers, and their answers were inspiring. The biggest takeaway message was that parents want to feel connected to their healthcare providers. If they could not see the provider that they had a personal relationship with, then they felt that they could go to the emergency room because they would be speaking to a stranger anyway. Not one parent mentioned convenience. The answers highlighted either the presence or the absence of relationships. Moving outside of the 4 walls of my health office allowed me to work with community-based organizations. The work evolved over the past 5 years and now includes a strong collaboration with the Camden Coalition of Healthcare Providers and the New Jersey chapter of the American Academy of Pediatrics. Our collective group is called the Healthy Spaces Community Collaborative of Camden, and we focus on ACEs, trauma-informed care, and violence prevention. In 2016, the Rutgers-Camden School of Nursing School Nurse Certificate Program, where I am privileged to be on faculty, received a grant by the New Jersey Nursing Initiative to redesign our program to infuse population health and leadership. Rutgers-Camden Nursing was the first program in the nation to build the school nursing curriculum on the NASN's newly introduced framework for 21st century school nursing practice. Based on the revision, our program moved from a post-baccalaureate to a graduate level certificate and infused population health and leadership into the coursework. Today, the second cohort of school nursing students are completing the rigorous program and now have an option to pursue an MSN in school health services. They will begin their practice with a foundational knowledge that being embedded in community is one of the principles of school nursing. Come on. There it is. School nursing is a specialty practice with a national certification designation. The states where school nurses are certified by the Department of Education, like New Jersey, where I work, or the Department of Health. But there is no universal school nurse, and the title of school nurse varies from state to state based on regulations that exist. Some states employ unlicensed assistive personnel, or UAPs. And while UAPs provide very important care, they are no substitute for a registered nurse. Looking at this slide, I know there's a lot of information on it, but these are the most important parts. Fewer than 40% of U.S. schools have a full-time school nurse. 35% employ a part-time nurse, and 25% have no nurse at all. Right here in Philadelphia in 2014, the Philadelphia School District eliminated 100 school nurse positions due to what they called budgetary concerns. Within 8 months of each other, 2 students died, and in both cases, there was not a nurse at school. One of the students who became ill had a known history of asthma, and she died later that night from respiratory failure after becoming ill during the school day. A nurse was assigned to her school just twice a week, but the day she died, there was no nurse present. There we go. This is a tough one. School nurses are also first responders in all emergencies, including school shootings. Since 2018, there have been 38 school shootings happening during the school day, reported nationally. This slide reflects 2018 data, but so far in 2019, there have been 14 additional school shootings. It is no surprise then that students and teachers feel unsafe at school and families live in fear that their child's school will be next. Active shooter drills are now part of the fabric of school, another challenge for school nurses to expertly manage. We need research to guide our practice, including the efficacy of emergency preparedness programs like active shooter drills and teaching Stop the Bleed training to students and staff. Every Student Counts is NASN's new data initiative and is designed to encourage a robust national health data set that will influence local, state, and national student health policy, identify best practices in school health, and better understand child health. This design will lead to policies that better support the needs of students, increase evidence-based school nursing practice, and better youth health outcomes. As Dr. Erin Maughan wrote, data helps build bridges that connect school nurses to the rest of the healthcare system. This initiative provides the support and structure for the collection and use of data by every school nurse, but funding is needed. School nurses are responsible for students from preschool to high school, ages 3 to 21, and have an incredibly diverse practice. Youth and adolescents may come to school with a variety of somatic complaints like headaches or stomach aches, or come in need of accommodations for chronic health conditions and special needs. Students coping with crippling anxiety that is interfering with their ability to learn are also evaluated in the school nurse's office. We have access to our nation's 55 million children and see 95% of them on a regular basis. We use our expert assessment skills, but have few tools, limited resources, truncated technology, and truly often work with unrealistic school nurse to student ratios. School nurses spend up to 35% of our time addressing mental health issues in children and adolescents, because up to 20% suffer from bullying, anxiety, stress, depression, and other similar concerns. Just this past July 12th, Massachusetts Representative Ayanna Pressley, spearheading groundbreaking congressional testimony for the Oversight Committee on identifying, preventing, and treating childhood trauma, credited a school nurse for saving her because she recognized the signs and symptoms of trauma that she had exhibited, even though she was a quiet but deeply troubled student. Daily aspects of our practice charge us with identifying health concerns that impact learning. Annually, we screen students for height, weight, blood pressure, vision, oral health, and in some states, scoliosis. We refer students who need further testing through our screening process, and we develop emergency health plans and coordinate care. As the chief wellness officers of our schools, because that's what we are, even if we don't have that official title, thank you, we also provide health promotion for our students, families, and staff. The next time you see a school nurse, please ask them what happened at school today. School nurses are also experts with immunization compliance and parent education. We are boots on the ground in the midst of this current measles outbreak, and in 2009, it was a New York City school nurse who determined, based on the fevers that she was seeing in several of her students, she reported it to the health department, and she was the one, it was actually the H1N1 virus that was found in her school. Nurse practitioner-led school-based health centers in urban districts are part of a solution to increase access to primary care and urgent care. Telehealth is another emerging model, especially in rural America, but school nurses have to be collaborating partners in these centers. School nurses have worked in this hidden healthcare system of school health for more than 100 years. I have to show you Lillian Wald here. The first school nurse was Lena Rogers. She was placed in the New York City school system in October of 1902 as a great experiment through the innovative idea of Lillian Wald. There is no better place to share this work than here today, as the future of nursing includes school nursing for the first time in this important conversation. But this is what we need. This is what we need in order to be able to practice at the top of our licenses and at the top of our power, to best serve children, families, and communities. First, we need to be in every school. We cannot make a difference if we are not present. As a recommendation by NASN, the CDC, and AAP, there should be a full-time school nurse present in every building. Better evidence is needed to guide our practice. Funding is needed for population-based and community-based nursing practice. That includes funding for research. Prioritize school nursing services in developing collaborative healthcare delivery models between school health services and clinical and community health providers. And we need to strengthen the collaboration with our pediatric providers by maximizing technology, bi-directional communication, by sharing health information electronically would be very helpful. This is happening on a limited basis in Ohio, Delaware, and Colorado, but what about the rest of the country? And a national registration for immunization would track our students as they move from state to state. School nurses also have to be lifelong learners and have open access to evidence-based research to guide their practice and keep students safe, healthy, and ready to learn. But let me end with a message, a personal message from a student that I have not seen or spoken to in 15 years. I have to take a breath for this one. This is what he wrote to me. Yesterday, my son was sent home from school with a project to do on their superhero. So I thought I should tell you that you are mine. I never told you this, but in the 4th grade, your kind words and warm hugs saved me. One morning, you allowed me to sit down in your office because you knew that I wasn't having a good day. The night before that was a really bad day for me, and the day we talked was the same day that I had planned to commit suicide. But thanks to your loving, warm words and hugs, I am able to be here for my sons and move forward with life. Thank you so much. I kept this story in for a long time. I just wanted you to know that you matter. I can't imagine what would have happened if there had not been a school nurse there that day. So thank you.